So, I want to welcome all of you. Thank you so much for joining the webinar today, Supporting Youth with Chronic Health Conditions in Out of School Time. My name is Claire Grace Jones. I am here on the CAHI OST team, which stands for the Collaborative for Advancing Healthy Experiences in Out of School Time. We also have an amazing presenter joining us today who I'm going to introduce in just a moment. And we have Bianca and Kate and Anna from my team who will be helping in the background and or popping in throughout the webinar. I want to let you know a little bit about our agenda for today. We are going to just do some brief welcome and introductions. Look at that. We're killing it already. We're going to have an opening activity in just a minute just to get everybody thinking. And as I said, we're so excited. We have a guest, not a guest, a collaborator, a partner with us today, Heidi Milby from the National Association of Chronic Disease Directors. So we're going to hear from her. You're also going to have a chance to ask her some questions. And then we're going to talk about some strategies for supporting youth with chronic conditions in out of school time. We really wanted to make sure that you were able to walk away from this webinar, not only with some big picture things and ideas and, to kind of get things percolating and brewing, but we also want you to be able to walk away today with actionable things that you can take right from the webinar today, and you can start implementing them right away. And so we always talk about when we're planning, we want people to think about, big goals, but also sometimes it's really nice, especially when things feel very busy, to also have some low-hanging fruit that can move forward quickly and be implemented. And then we'll give you some time at the end again for reflection and next steps and to offer us your feedback. I just want to, again, let you know who we are. As the hosts of this webinar, the Collaborative for Advancing Healthy Experiences in Out of School Time, otherwise known as CAHI OST. We facilitate trainings. We bring peers in the out of school time space together. We really want to help people, again, think about how to make practical changes, how to look at their practices, how to look at their policies. We want to promote the use of best practice and evidence-based, and we want to make your lives easier by doing some of that work for you with resources such as we're going to share with you with this webinar today, that we have really gone through and looked at what the evidence says, looked at what the best practice is, and taken the time to curate these things for you and then bring them to you so that you can move them forward in your work. We also, sorry, my computer screen's being strange. We also work to foster partnerships. So we want you all to have the opportunity to connect and partner with each other. We want to bring you amazing partners that we work with, such as Heidi, who's here today. And we're also very fortunate to have a strong partnership with the National After School Association, and want to acknowledge our funder from the CDC Division of Adolescent Health. They are amazing partners, and we always appreciate their support for our work. So, without further ado, I'm going to just give a very brief overview of a couple things, and then we're going to jump into an activity. Drop an emoji in the chat if you are already familiar with this approach, if you've seen this graphic before, if WISC is something that is kind of in your everyday talking about whole child health and wellness. We know that out of school time programming works. We know that having kids be able to be part of, whether it's before school, it's after school, it's camp, whatever that might look like, that it gives kids access to healthy foods and physical activity, safe environments, healthy adults. It gives them opportunities to interact with each other and to do things with purpose. It supports positive relationships. And research shows that participation in quality after school programs improves student academic, social, and emotional success. So I'm preaching to the choir. I'm sure that all of you on this call already know that the work that you are doing not only feels good and you can see it on the faces of those kids every day, or maybe not every day, but most days you could see it on their faces. But we know that out of school time has real long lasting demonstrable effects. I'm going to stop the screen share in just a second here because we wanted to start by hearing from all of you. We know that all of you are already probably doing a lot of things that would be helpful to share with each other, that there's so much wisdom from within those of you who are on with us today. And so we're going to use Padlet. I'm going to stop sharing in just a second, and Kate is going to bring that up. But you can use this QR code or you can use the link in the chat to navigate to it. And what we'd love you to share is the barriers to that you are finding to identifying and supporting youth with chronic conditions, and what have you already done or tried that has been successful. And so Kate's going to bring up the Padlet, and I'm just going to give you a quick tutorial if you're not familiar with it. So basically, the easiest way to use this one is you'll see the question. So first question are barriers. You click the little plus sign, and then you can type in your thoughts. You can also, if you want to write a little more, you can type down in the bottom there, and then you just click publish, and it's going to show up right under the question. So you can click the plus to answer the one question, or you can click the plus to answer if you have ideas of what you've already, what things that you've done that have been successful. This Padlet is also set up so that you can like and comment on other people's posts. So feel free to do that as well. So I'm going to give you just a minute to share some thoughts in the Padlet. And if you don't have access to the Padlet, or if it's easier for you, please feel free to share your thoughts in the chat as well. And so we're seeing lots of things already as far as barriers or challenges. Um, Even having families that allow their children to stay after school, knowledge, um, not supporting treatment needs of students, being afraid of a HIPAA. We're going to talk a little bit about information sharing. We're actually going to talk quite a bit about information sharing today, so hopefully that will be helpful. Having lots of different needs and knowing what's helpful and what's not. Lack of communication. We're going to talk about that today too. We're going to talk about a lot of these things. Families might not want to disclose information or might not have a full understanding. Great. Keep them coming. Parents that aren't aware, children that aren't aware. Yeah, we hear lots of these things. And so feel free to keep sharing. But things that folks have done that have been successful. So someone's sharing about a diabetes club at the high school that provides education to elementary classrooms. Good relationships with parents means they'll share more about what's going on with their kids. You're getting lots of likes. Showing care and reaching out, creating a universal design plan for all students. We're going to talk about that a little bit too, about things that you can do for everybody. Collaboration with school nurse and the team. All of these things as we're talking, I'd love if you're gonna in the chat as we move forward today, please feel free to share specific ideas or things you've done that you have found helpful. Asking for accommodations that work for the child in the school and at home. And having adults that are aware and monitor. Absolutely. This feels like a great set up to now introducing Heidi. So I'm gonna, if you want to keep puttering in the chat, feel free, but I'm gonna bring the slides back up. And it is my pleasure to introduce to you Heidi Milby. She's the Associate Director in the Center for Advancing Healthy Communities from the National Association of Chronic Disease Directors. And I'm going to hand it over to Heidi.
Great. Thanks, Claire Grace. Hi, everyone. Thanks so much for being here. I love the conversation in the Padlet. It's just, I don't know, it's making me think all about different ways that we could enhance some of this work. But really glad to be with you all today. As Claire Grace mentioned, I work for the National Association of Chronic Disease Directors, or NACDD for short. For folks that aren't familiar with us, we are a national nonprofit membership association, primarily for those that work for state health departments, but really anyone that's working in chronic disease prevention or health promotion. In my role, I lead all of our school health work, which brings me to the conversation today, and thinking about how do chronic health conditions play into overall, how are we supporting children's health when they're in the school setting and when they're in the out of school time setting. So really pleased to be with you all today. What I thought we could do, we're going to have a little bit of time for Q&A, but first, just for the purposes of level setting, wanted to talk a little bit about what we're talking about when we talk about chronic health conditions in youth and what does that prevalence look like. So I'll share a little bit about that. We'll talk about why it's important, and then we'll dig a little bit more into the Q&A. But first, just to kind of level set, what we know is that about 40% of youth have a chronic health condition. And this is including things like asthma, allergies, diabetes, things you might think of, but it also includes things like ADHD, depression and anxiety. So more of those kind of behavioral, neurodevelopmental conditions. It also includes obesity, actually. So that number 40% is higher because it's a very inclusive description of youth and their chronic health conditions. But for the purposes of today, when we think about managing chronic health conditions, particularly in an out of school time setting, we're mostly talking about those where there might be a medical emergency. So we think about things like asthma, food allergies, diabetes. So I want to talk a little bit about those in a little bit more detail. And that's probably what you'll be thinking about when we get into the conversation today. So first, youth is the most common chronic illness in childhood. About 5 million children have asthma. So, for example, if you look at an out of school time program where you have 30 kids, three of those kids are likely to have asthma. So it's about 10% of kids. So really common when compared to other chronic illnesses. We see a slightly lower percentage of youth, so about 6% that have food allergies. And some of those top allergens are ones you're likely familiar with when we think about things like milk or eggs or nuts or soy. But also really important to consider, how do we support those kids, particularly if there's a snack served during that program or supper or meal. And then finally, less than 1% of youth have type 1 or type 2 diabetes. And while that prevalence sounds low, when we think about the medical needs when it comes to diabetes, particularly type 1 diabetes, where there may be an insulin pump or an insulin injection involved, it's a really critical chronic health condition to consider. And beyond that, we know that type 2 diabetes continues to rise among children and youth. So that's also an important consideration and something just to really think about, particularly, if you run an out of school time program where there is physical activity, exercise, as I mentioned earlier, food served, really important consideration when we think about children with diabetes. So that's a little bit about the prevalence of chronic conditions. I mean, you all are here knowing that this is important, that this is challenging, that this can be really overwhelming when we think about all of the considerations for supporting these kids with their conditions. But I do want to just talk very briefly about why this work is so important, again, just for the purposes of level setting. So when we think about the importance of this work, the first thing for me that comes to mind is these healthcare needs can be complex. They can be continuous, depending on the severity and just kind of the ongoing maintenance needs of some of these chronic health conditions. So this is especially important when we think about starting a new program where it might be a change in routine for that child, where they're maybe not able to manage their chronic health condition as easily in a new setting. So really important to consider, when we think about, I'll go to that diabetes example. If we have a child with type 1 diabetes and there is physical activity, that child needs to have that understanding and recognition. And you all as a provider, as a supporter, really understanding, when does that child need to take a break, have a snack to maintain those optimal blood sugar levels. So really important to think about these kind of complex and continuous needs. The second thing I think about is this idea of, we really need to support the child from that holistic perspective. So Claire Grace, you brought up the slide that showed the whole child model where we think about, children that are healthy, they're safe, they're challenged, they're supported, they're engaged. In order for a child to show up fully, they need to be supported in all those elements. And if they know that they're showing up, knowing their needs are going to be cared for, knowing that they've got advocates looking out for them, it's going to result in them being able to more fully participate and more comfortably participate. So when you think about including all youth, and even going back to that concept of universal design that showed up on the Padlet, I think this is a really important consideration that by supporting youth that have chronic health conditions, it's one other way that we can really support youth in fully participating and feeling included in the program. And then finally, and this came up so frequently on the Padlet, and I know it's going to come up later on, but when we think about that continuity of care between home and school and out of school time, super critical, particularly, when we think about, I'll go back to that type 1 diabetes example. If a child is constantly up and down and their blood sugar is not maintaining that consistent level, that can really result in their ability to come and fully participate and feel healthy and feel good and in the long term meet their overall goals, right? So this idea of providing that continuity of care can be really critical for children as they manage their chronic health condition. So I know I'm preaching to the choir here that you all know this work is important, but I thought it might be helpful just to kind of reiterate, especially as you think about, you know, if you're in a position where you need to advocate for more policies or protocols or mechanisms in place to support youth with chronic health conditions, these are kind of the top three that I go back to, reiterating the importance of this work. Um, so I'll kind of pause there, and I think maybe we'll move into a little bit of the Q&A portion of today's conversation. But again, really grateful for y'all being here and kind of elevating the importance of this issue in your own work. Oh, Claire Grace, I think you might be on mute. Technology, I know it.
I was on mute. Thank you so much. Okay, great. So I feel like that was a lot already. But what do you think are the most important things for out of school time providers to consider when it comes to supporting youth with chronic conditions?
Yeah, so um, first I'll just say that like I find it very overwhelming, and I'll also just share that I have type 1 diabetes. I was not diagnosed as a child. I was diagnosed as an adult, but I often doing this work think about how challenging that would have been to be an adult supporting a child with type 1 diabetes. So I kind of have this renewed sense of appreciation for all that goes into it and how challenging this can be. So that being said, I think for me, what's most helpful is to kind of take a step back and ground myself in, what are the most important things? Because I think it's easy to get overwhelmed with medical complexities or all the policies and protocols or all the things I need to do for an ideal situation, when I might just not have the capacity to show up in that way. So in saying that, I hope what I'll offer to y'all is this kind of framework, if you will, but thinking about five key questions. And so the first, and we'll have a slide that kind of like outlines some of these later on for folks, just as a reference point. But the first thing I think about is what does the child need and what, and similarly to the family. So I think about what came up on the Padlet, where that child might not know the full extent of their chronic health condition or how to self-manage. So I think that's where certainly the family comes into play. But it also builds into what was said on the Padlet around building relationships, right? How critical it is to build relationships. This can be a mechanism to do that, to ask questions, how can I support you in this time? And that child might have really good grasp on when they're experiencing an allergic reaction or when they're starting to feel like their blood sugar is dropping. They might not, and they might need additional support. So I think initiating that conversation to really understand what does that child or family want and need is the first thing I think about. The second thing is how can school staff and providers be involved? And I know there's a whole rabbit hole we can and will dig into when it comes to this, but that to me is a real fundamental question. Are there solid pathways for how you as an OST provider or staff member can stay connected, whether that's the school nurse, which I know can be challenging with schedules, whether that's a school wellness or school health committee, whether that's the child's, pediatrician or doctor, at least having that contact information. That I think can be really determined based on the complexity of the child's health condition, but then also what that family and child wants and needs. But that's just another consideration is how can that communication channel be open? Which kind of leads me into that third piece, which is what information can be collected and shared regularly. So that's twofold. So I think about things like when a child signs up for an OST program, what information is being collected at registration that can help inform future communication needs. So if a child says, yes, I'm allergic to nuts, then is there a further conversation that should happen with that child's family around, what does that look like? What safeguards need to be put in place, et cetera. So I think about kind of that initial information and then that continuous flow of communication. I think that also ties back into the relationship building, right? Communication is such a key element for building relationships. So that's the third piece is kind of looking at information. And I think we'll talk about that later on today. And we think about how to best do that, also thinking about sensitive health information. The fourth thing that comes to mind is what do you do in an emergency? And this should probably be the first thing that comes to mind, although I'm always thinking about the child first. And that's why I say, like, what does the child want and need first? But what do you do in an emergency? And I'll ask Claire Grace and team to pop a link into the chat. There's tons of templates out there just to make this easier for you. There's one that comes from the school nurse chronic health assessment tool. If you go in there, they have template emergency plans. And this is just one example. There's lots of resources elsewhere that you can just pull. What's an emergency plan for a student that is having an asthmatic episode, having a diabetic emergency, having a food allergy reaction. So those are nice things to have in hand so that you know what to do in an emergency to protect that child. And then the last one, I have to mention it because I work in the world of, policies and systems, is what policies and protocols are in place. I saw someone put in the Padlet, no medication can be administered after 3 p.m. when the school day ends. That's a very real policy. And so, what happens when a child is requiring emergency medication after 3 p.m.? Is that documented? How do out of school time providers or staff access medication if it is permitted to be administered, et cetera? So, I do think that policies and protocols piece is a really important one. It's some that sometimes takes a little bit of time, but really critical as you think about long term supporting students with chronic health conditions. So, that's a lot. I know I said a lot right there. I was trying to think of like, is there an acronym or something to kind of cement this? But as I mentioned, we'll kind of share some of these questions, and this will come up throughout the conversation. But just to kind of recap, the things I think about are what does the child and family need? How can staff or providers be involved? Information, emergency, and then policies and protocols. Those are kind of the things I think about when I think about how to best support students with chronic health conditions and out of school time settings.
Thank you. And I'm actually reaching out to Kate to say, can you just pop those in the chat right now so that we can we'll keep looking at Heidi while she's talking and answering some of your questions, and then we will bring that slide up in a minute. But we'll pop those questions in the chat for everybody as well, just so they can see them for reference, I think, while we're talking. I want to see, let's take a minute to see what questions folks have. And also, so if you have specific questions for Heidi, also, I want you to be mindful that our hope is, she's kind of setting this all up for us, and then I'm going to go through and unpack a lot of these in more detail as we go. And so we may also say like, oh, we're going to share something in just a minute. Or you may have more questions that come up as we go along, and you can just keep coming at them in the chat. But if you've got questions about anything that Heidi has said or shared already that you want to put in the chat. And, Heidi, I really appreciate you sharing also, that you're coming this from some of your own lived experience and looking back on that. I didn't share in the beginning, but I also come at this work not only having worked in prevention and public health for about 20 years at this point, but being a parent with a fairly complex chronic health condition that I had to navigate through school and out of school time things and all that. So I just wanted to share with folks that this is dear to my heart also, and that, as a professional getting to help develop some of these resources, also definitely put my parent hat on, quite a few times. And so just wanted to share that. And I'm sure lots of you on this call also come at this from, multiple roles and from your own lived experience. So great question, Barbara. So Barbara says in the chat, she's blessed to have great relationships with families, but she has experienced cultural differences. How do you navigate those?
Yeah, Barbara, that's such a good question. And I was, even when information was coming through the Padlet around kind of families and respecting family differences in terms of, how they approach this and how they approach care for their child and medical needs. And I don't really have a good, holistic answer other than to say that I think what you said around great relationships, I mean, for me, it goes back to building the relationship with the family and really understanding what the situation is, but also how do they want you as a out of school time provider staff member to show up for your child as it relates to their chronic health condition. I do think sometimes, and I'm saying sometimes because I know that this is not an easy conversation to have, and it's not a one-time conversation, but sometimes that can open the door to really understand a little bit more about some of those cultural differences in terms of how that shows up, and how that shows up in your relationship. I'm also thinking about my child's school is extremely diverse. There's over 35 languages spoken. Everything we send out, goes out in 7 languages. And I know our out of school time providers have experienced that, whether they're a teacher providing a after school program or kind of the contracted vendor that comes in. And yeah, I mean, I just think it does go back to relationships and acknowledging what they need and want. And at the end of the day, right, your role is to be an advocate for the child. And so I think that emergency piece is always going to be in place. But starting with relationships, starting with aligning your support with their cultural values and what the child needs, I think is a great place to start. So um, I don't know. I don't know, Killer Grace, if you would add anything to that. That's coming to mind for me as a way to start approaching that issue. But I think it's challenging, it's complex, and it's such a great question.
Yeah, I mean, I don't think I could have said it better. We're going to talk a little bit as we go on here about some specifics and just some ideas about communication, especially with parents. And I always think that's key. And even when building communication with partners, I think being able to ask how people prefer to communicate and that it goes beyond just language. And so, I think that sometimes, do we need a translator? Especially if there's a meeting where medical information is going to be shared. Being familiar with best practice, that especially when it comes to medical information, we would never ask a child to do that interpreting, between a parent and a staff member, that you need to, you want to have somebody that's a qualified interpreter. But sometimes also when you're just having conversations on the fly, I find actually had a plumber here this weekend who was amazing, but did not speak English very proficiently. And so there were times when he was trying to explain something to me that we actually found it easier that we were standing right with each other, but if I texted him something on my phone, he could immediately translate it and read it on his phone, and then he could text me back the answer, and I could see the answer on my phone because when you're talking about someone connecting your, water heater, you don't want to miss anything in translation. And so we found that really helpful. And so it might be also, do you prefer a phone call? Do you prefer to text? Do you prefer to get something in writing that you can take home and have somebody else help, look through with you, or do you want us to read it through with you? And then, like you said, I think the cultural considerations also of how open are people comfortable talking about health conditions, or with whom in the family or with whom in the program are they comfortable having those conversations, and how can we make that more comfortable? So I think those are really helpful. We've got a few more things coming in, so I'm going to read these, and then I'm going to bring up your 5 things on the slide, just so that we can take a look at those. So we want to know about the level of expectation of a parent caregiver in relation to the staff, between the staff in a school setting and one in the community. And so we'll talk again. We're going to talk some about that communication piece. And Monica, thank you for sharing that her daughter, who's in college now, had sickle cell anemia. Made sure her teachers in school all had a copy of her accommodations from her 504 plan, a one-pager explaining what it is. And we've talked about that as a team. We've mentioned it in some of our other resources. I will say it's not front and center in these resources, and yet a significant impact, especially within particular communities. And so that is something that we'd also be happy to share some additional resources out about, because we want kids to feel safe and empowered. Labor-intensive physical activities. We have noticed that some people might have asthma or chronic heart conditions, monitoring them without feeling like they're hovering, checking in. And I think, again, we're going to get into more of our specifics with these in mind, because I think this is part of balancing both that proactive planning and communicating with kids and families, as well as the emergency planning. So Heidi, while I bring up the slides, do you have anything you want to say to any of those, or any last kind of thoughts for right now?
Yeah, well, John, I'll comment in the chat too to some of these specific questions, but I think just in kind of summarizing and kicking it off to the rest of the conversation, I think at the end of the day, it's so important to be that advocate for the child, right? So thinking about, are you aware of conditions? at least at a high level? Do you know what to do in an emergency? And are you doing your best to kind of coordinate that communication amongst those that need to be communicated? So I think being an advocate is the number one role. And there are lots of ways to do that, which, we'll talk through. So I'll stop at that, Claire Grace. I'll pass it back to you and I'll keep an eye on the chat.
Awesome. Thanks, Heidi. I appreciate that. Um, Questions and discussion. We just did that. So first, I'm about to share with you a whole bunch of information and some additional resources, but I wanted to tell you we are very excited about this new resource that Kahi OST has just designed for supporting youth with chronic health conditions. This is going to be available and will be shared with you in the webinar follow-up. So again, after the webinar, you're going to get a link to access this resource. You'll get a copy to the slides. We'll make sure that that's available. I am very excited about this resource. It's got all these great sort of clickable links to find out more. It's packed with ideas and resources. So we're going to move into actually unpacking some of the things again that this resource that we've created will delve into. And so when we think about how to best support youth with chronic health conditions in out of school time, which also means, as we've said, supporting parents, supporting staff, thinking about the team overall. The first kind of bucket that we really look at is creating safe, healthy, and responsive out of school time environments. And this came up, I think, in the Padlet also in talking about universal design, talking about things that are good for all kids in your program, and then how you are going to put in additional accommodations, adaptations, things that you're planning proactively in ways that you plan for emergencies. And so the first thing and I really appreciate Heidi said this several times too, is to meet youth where they are. Just making simple changes sometimes can help youth to feel safe and to know that they belong, whether it's adapting curriculum, it's adapting schedules, activity options. This is where that comes in, that you know that you're doing something that maybe is going to be outside when it's hot. Maybe it's going to require a lot of exertion. And so allowing for flexible participation. And maybe you allow those flexible participation options that you're just putting them out there for everybody who's participating. And you're saying, hey, we're going to be outside for the next 20 minutes. It's really hot. So let's remind ourselves how we listen to our body. We're going to do a body check and we're going to, maybe we're going to stop 5 minutes in and we're going to say, am I really sweating? Is my body feel hot? Am I thirsty? Do I need to take a break? And maybe you walk through that with all of the kids. And so that the kids who need that prompting, that they maybe do need to break, they do need a rest, they do need to get some additional water. And so how can you build in that flexible participation for everybody during an activity so that those kids can take advantage of that? Breaks as needed. Again, promoting peer norms that visualize those health routines. So for everybody, it might be checking in on how my body's feeling, but it also could be just making it that there's no stigma to it. If we've talked to Heidi about it and she is comfortable, Heidi's over there, she's using her insulin. We're just going to give her a minute while she does that. And when she's ready, she's going to come on back with the group, that we're just normalizing that. Maybe somebody needs to go and grab their inhaler. Oh, they're just using their inhaler. Or maybe we're watching a movie and there's a kid in the movie that is using an inhaler, that we're, a health video or something. And so building in routines, scheduled times that everyone is getting a break for hydration, or that things are happening while we're giving medications at this scheduled time, building those into daily schedules reinforces healthy habits for all of the youth in the program. And so we'd love for you to share in the chat any ideas you have for how you currently do these kinds of things. And feel free to pop those in the chat so you can all take a look at each other's thoughts while I share a little bit. Again, when we think about this idea of kind of universal design, of how do we build things so that we are actually meeting the needs of many of our students, of many of our learners, because things that you might adopt because it's helpful to a specific set of students. It can actually be beneficial to all of the students. And so one of the things that we wanted to share are the National After School Association's Healthy Eating and Physical Activity Standards. If you are familiar with the HEPA standards, I'd love it if you would drop an emoji in the chat and we can see how many people have heard of the HEPA standards already. Or feel free to use your react button. I'm gonna take a quick look over here and see anybody already familiar with the HEPA standards. Just drop something in the chat to react. Great. All right, lots of folks. Um, if you have implemented one or more of the HEPA standards, drop something in the chat while I tell folks about them. So the National After School Association, with a whole host of partners, developed these HEPA standards back in 2011, and they provide practical guidance to out of school time programs. They're evidence informed. They basically translate nutrition and physical activity science into actionable things that programs actually can do to increase healthy access to healthy foods, to physical activity, healthy beverages. They also, what I love about them is they talk not only about some of that quality and content. They also have standards that talk about staff training, program culture, policies, management, the environment, kind of building all of these things around that support that best practice. We do always, when we're talking about HEPA, kind of note that they're aspirational. They're meant to be a guidepost. There are a lot of standards, and so it can be challenging to take a look at them as a whole and think, oh my gosh, how would I possibly do all of these things? But the best thing to do is just jump in and get started. As I said earlier, sometimes setting a big picture goal that, we want our goal to be by the end of the year that everyone in our program is getting 60 minutes outside of physical activity every day. And so we're going to start from where we are and we're going to work toward that. But in the meantime, we also could fairly immediately switch that we only are serving water as beverages, and we're going to make sure that everybody has access to water. If that's something that you're able to do. I also wanted to let you know about this resource that CAHI has created. It's called Our Assessment to Action. It's a guide and a workbook. You can get to it through this QR code. I think we're also going to pop the link in the chat. We also often have training opportunities. We have some archived videos that we could share with you for how to implement this. And basically what we have done is put a guide together to help you break this work into very small, discrete steps. So starting from where you are, building a team together, thinking about what you want to work on, what might get in the way, might be challenging with that. What do you need to do to make this work? To actually putting an action plan together so that you can get to implementation, to making policy changes. And so we wanted to let you know that all of these resources are available to you. The next thing that we think about is supporting professional development and building a supportive culture. When we're saying it's so important to meet kids where they're at, it is so important to build relationships with parents, we first need to build staff's confidence in doing that. And so, really prioritizing being able to provide ongoing training to staff so they feel confident in managing daily health needs of youth and responding to emergencies. So, this training should not only cover common chronic conditions, as well as conditions that are present in your program. How to recognize symptoms, what kind of accommodations might be needed, emergency procedures, the safe use of health devices and medications. We also want to build staff's confidence in adapting activities and in meeting youth's needs in real time. And so that goes beyond one in-service training that focuses on this. Maybe that's something that you're taking 5 minutes out of, each staff meeting that you have to do a brief role play or to practice, having what would it feel like to have a conversation with a parent? You're having maybe some more seasoned staff or leadership staff invite other staff in to have these conversations so that they can be modeling how they're building these relationships and building that comfort. Oops, sorry. I'm trying to click my slides ahead and I'm clicking the chat. All right. We also want to think about how we build a network of care through collaboration and shared leadership. I cannot emphasize enough really thinking about all of the players in this as being a team together. Youth and families, staff, school nurses, school wellness councils, outside providers. What are the things that you can be doing to help center and raise the voices of all of these folks together in doing this proactive planning and problem solving, that we're not just waiting for an emergency to happen. And so involving youth, wanting youth to be active partners in their health when it's appropriate, involving them in their planning and accommodations, creating spaces for them to express their needs, for them to share things that work for them, using a strength-based approach. We really want to be centering youth as experts in their own condition. What works best when this happens for you? How would you like us to be talking about this in front of in front of your peers? Or how would you like us to be, talking about this to other adults that are in the program? Really empowering them to have that autonomy and to own their own communication about that. Supporting them in setting their goals, having them be involved in the creation of their individual health plan, co-designing parts of their schedule or activities. Again, not only, when you think of the benefits of out of school time, not only did these things help that student in that moment, but it also is building lifelong self-management skills for themselves and for managing their chronic condition. When we think about empowering families, again, doing this in a way that shows that you value and are centering their knowledge, their culture, their strengths, that they are the expert on their child, and starting from there. And so maybe there are things that you can't do in the out of school time program that they do in school, and you want to explain the difference between those things. But starting that they know their child best, they know what works for their child, and building from there. You want to also, helping parents to become advocates. I am a huge fan of, in all of these steps, really walking parents through these things, ensuring informed consent. I would never hand a paper to a parent that for, consenting to sharing some information, or, hey, can you fill this out so that I can get it to the school nurse so that, we can get a copy of the health plan and it says that you've agreed to it. I would never just put a piece of paper in front of a parent and have them sign it. I would say, I want to make sure that you understand what this is. I want to make sure that you understand by signing this, it means I can find this out from the nurse and the nurse can find this out from me. I want you to understand that by signing this, it means I can do this for the whole entire school year unless you tell me, nope, I'm going to write on here, I want you can do this for a week and get what you need. And then I don't want you doing that unless you ask me again. Whatever it might be, it's really important to empower families to understand what's happening as far as communication, what their rights are. Um, and then just, as school nurses, wellness councils, any opportunity that you can have to connect with health related, wellness related staff at your school, becoming a partner with them really is an opportunity not only to facilitate communication, but potentially also for shared resources. Maybe they're having a training that all of the school nurses are attending that's coming up on asthma management, and they're already paying for the training. They've already got space for it. And they say, oh, we don't mind if your staff want to join that also. And so knowing that there's that opportunity for collaboration and shared resources. And then encouraging collaboration again among this core care team, among each other to think about, what are the pathways to that communication. It's just, I feel like I feel like a little bit of a broken record, but I just feel like I can't say it enough, that communicating clearly, consistently, and proactively. And so being able to communicate, develop, and communicate clear policies. I think all of us know a policy is only as good as being able to communicate it, have people's engagement, and buy and to follow it. And so establishing written policies that guide How are we going to know that someone has a chronic condition? How are we going to support it? What are our emergency response plans going to be? Those are all really important, but making sure that those are then communicated, that everyone knows how to find it, that everyone feels comfortable communicating to a parent what it is, what it means, where they can find it. Um, and this again, these policies really should range all the way from first interactions from parents and how you're identifying a chronic condition to what are we going to do day to day to be proactive, to manage medications, to manage schedules. How are we going to respond in emergency? And then I think sometimes people also forget that post-incident debriefing, that you do also want to make sure that you have a policy around what do we do after an emergency happens? How do we document how do we go back to our documentation to say what went well, what could we do better next time? How do we ensure that staff are cared for? I can tell you that watching a child have a seizure is incredibly scary, and in the moment, you are there, you're doing the things, but afterward, you might need some time to take a beat. And that child is going to need some recovery time and a plan for returning. And so that post-incident policy and practices is really important as well, and should be, and we don't want you to forget that. We talked some about this already, establishing collaborative communication systems. Again, I think the best policy is always to ask, how do you like to be communicated with? What's the best time of day to communicate? Do you like to use Messenger? Do you like to use text? Is it better to text you during the day, or is it better to text you in the evening? Would you rather meet in person? And this is true not just for parents, but providers. I've worked on projects where I've worked really closely with pediatricians, and they have said, I know this is going to sound weird, and please do not apply this to all pediatricians. This was one pediatrician, I should say, that I worked with. Her preference was that I text her if I needed something at 7:30 in the morning, because that was her little window that she had when she was done with her own kids, before she jumped into her day, that she could be available to answer quick questions over text. And so we set that up beforehand, that was what worked best for her. There are also more formal ways to exchange information. We have a couple resources here that we wanted to share with you. Using shared consent forms can be an amazing not only way to have clear communication among all the parties, but honestly, a huge time saver, because I can tell you as a parent, I often ended up being the person that, because the school nurse wasn't able to talk to the out of school time program, I would say, okay, great. So she would give me a copy of my child's individual health plan, because as the parent, could have a copy of it. And then I would have to give it to the out of school time provider. And then I'd have to make sure that there was medication at school and also medication at the provider. And then I would have to, if anything changed with our other provider, I'd have to communicate that to everybody. I was also sometimes expected to be the expert in my child's health condition and provide information to all of these people. And so having things like this school health information sharing toolkit is incredibly helpful. The AAP and the National Association of School Nurses created this. We're going to put the link in the chat. And it is something that you can adapt to out of school time. And what they endeavored to do was to create one consent form. It's called a bi-directional consent, so that multiple parties could sign onto it, and then they could all share information, instead of, I'll only share information if you signed my particular form, and then you have to sign this form so that we can share information. That's a great resource. Also, something like a memorandum of understanding. There's templates out there. You can make it as super specific and formal, or less specific, to meet your needs. But it's basically sitting down and creating a written agreement that says, as a partner together on this, you're going to agree to do this. We're going to agree to do this. Here's how that's going to happen together. Here's the time frame. It can be incredibly helpful to get those processes with partners written down. And then it may also just be things like, we're going to create a timeline together. We're going to create a calendar together that I'm going to touch base with you once a quarter. We're going to put that meeting on the calendar, and that's when that's going to happen. Lastly, I just wanted to take a minute to talk about the importance of being proactive with families. Again, I think we have said this many times throughout today, but supporting them with everything from completing intake and forms around medication administration, explaining how policies work, explaining why something maybe seems like it's not going to be able to work in the out of school time setting the same way that they think it would be, and approaching that to come together with a strength-based, problem-solving, focused lens. Proactively establishing those relationships is will really take you a long way, and also being able to establish relationships with those partners and other care providers so that you can have these warm handoffs and this shared communication back and forth. Lastly, I'm going to share just a couple of additional resources that Heidi shared with us. The just so that you know, and we're going to send these slides out to everybody. You do need to become a member to access these, but they have lots of membership levels that are free. So, it's just one of those like create the free login, and then you'll be able to access these resources. But these are incredibly helpful. We wanted to make sure that you were aware of them. And I am going to now hand it to Bianca. Please don't go. We've got some great things coming up we want to share with you, as well as an opportunity to give us your feedback. So, Bianca?
All right, thank you so much. And I just want to give a kudos and a round of applause to both Claire Grace, I call Claire Grace CG, but Claire Grace and Heidi for that phenomenal content. And while we take some time to really digest that really, really good information, we thought it would be best to do that via reflection. So let's take some time for you to think about what do you want to celebrate that you are already doing well, and how will you build on this? We also want you to take some time to think about where do you see opportunities for improvement or innovation, and what next steps can you take? Because again, all of this information was fantastic, but now we need to figure out what can we do with all of this really good information that we've learned. So feel free to share in the chat if you are able to do so. What opportunities do you see for improvement or innovation? And what are some of the next steps that you can take, whether it's reviewing some of the resources that were shared or reaching out to EDC, Kahi OST, excuse me, or our partner collaborator Heidi to figure out, what are some next steps we can take to make our programs healthy. And one of the great ways to do that is by keeping our programs healthy, is to connect with Kahi OST. And Kahi OST is doing some great things, including participating in the NAA convention, which is going to be held in Washington, D.C. this year. Feel free to drop an emoji in the chat if you are familiar with the National After School Association conference, and if you will be in attendance, because we will be. And so if you are going to be there, we look forward to seeing you. We also look forward to staying and connecting with you, staying in connection with you, excuse me, through our newsletter. Our recent newsletter recently went out that talks a lot about chronic conditions and supporting our young people and staff within OST programs, and additional great resources that we shared here today. And then also, last but not least, we would love for folks to share your ideas and successes with us so that you can be part of our Healthy OST Champion. It is a great link that is available on the slide, and then will be also available at the end of the session as well. It's a great opportunity to highlight the work that folks are doing on the ground and really provide a spotlight for the folks that deserve it. And so in moving forward and talking about all of the great work that folks are doing, we also want to talk about an opportunity for learning. And this is our HEPA in Action Learning Series. Our next session will be coming up in February. It will focus on the content area of social support, and we will take some time to go over the amazing standards that really help create an OST program that is safe and supportive and a welcoming environment for all. And as we move forward, we really want to take some time to hear your thoughts. As we were wrapping up today, we really want to know what are your insights, what are your thoughts, and give us your feedback so that we can not only improve our work and our content, but really also figuring out what else can we do to support the amazing work that folks are doing here today. So if you have the opportunity to do so, would love for folks to complete a 3-minute survey. The link is in the chat. Thank you, Kate, for putting it in the chat. Or you can utilize the QR code that is presented on the screen here. Again, this is so important to the work that we do. For those who are grant-based, you all know that feedback surveys really help make the work continue. So again, thank you all so much for your time. Thank you all so much for your engagement. If you have any questions or concerns, please feel free to reach out to us at healthyost@edc. Again, Heidi, thank you so much for your time and your expertise. Claire Grace Jones, also thank you for your time and expertise. Kate Goddard and Anna Bohr and myself, on behalf of the team, thank you all so much for the work that you all do, our participants, and feel free to reach out to us at any time. And again, please fill that survey out. We really need that feedback from you. So thank you again. And we look
Looks
forward to
like
seeing you.
Heidi, were you just waving at us, or did you have one last
Oh,
thought?
yeah,
I was
please.
given a round of applause.
Oh,
No, I was
Oh,
given a round
great.
of
yes, great.
applause.
Yes, and
Thanks all for
we
being
look
here.
forward to seeing you all at a future event. So again, thank you all so much for your time. And again, feel free to complete that Qualtrics survey for us. Thank you again.